Doctors and nurses making rounds together used to be a familiar sight on hospital wards. Now it's being claimed the practice is being neglected because of the pressure on staff.
The Royal College of Physicians and the Royal College of Nursing says it means patient care is suffering and the NHS has to find a way to make ward rounds a priority again. Well, joining us now are Dr. Linda Patterson from the Royal College of Physicians and Andrew Chidgey from the Alzheimer's Society. Morning both, thanks for joining us. Linda, let's just talk about the problem, because everybody, many people watching today will assume that ward rounds still happen, doctors and nurses are involved. Is that not what's happening according to your evidence?
It still happens in many cases, but not all the time, and we've seen a gradual erosion of that because of the pressure of work. Nurses and doctors are both very busy with a rising number of admissions. The acute wards are very frantic and they may be pulled in more directions than one, and really the priority of getting together to jointly look at the care of the patient and communicate with the patient together has been lost. I've been a consultant for 27 years and I have never done ward rounds without a nurse being part of the team.
Is it
but
not
that's less common now.
People might be curious that it's not a requirement. I mean, are they not required to do that? Is that not part of, if you like, what they're required to do?
Well, I think we have custom and practice on the wards, and the practice has been eroded, and that's really why we as clinical leaders of doctors and nurses together have said professionally we need to talk about this, and we need to get back to that good communication between doctors and nurses. It's really important because I can see a patient, I can discuss the medical issues, the results, the x-rays, etc., the treatment, the drugs. The nurse brings the perspective, knowing the patient on the ward, can talk about hydration, food, pressure areas, bed sores, mobility, beginning to plan for discharge, and together we can have an overall view of the patient.
So Andrew, tell us a little bit about what you're obviously interested specifically in Alzheimer's patients. So what do you hear from those who are in hospital?
Well, I think it's distressing enough for anybody going into hospital at the best of times, but if you're an older person, perhaps in your 80s and 90s, and you have a cognitive impairment like dementia, then you're going to get very disorientated and perhaps confused. You're dealing with a range of medical conditions that you're probably in hospital for, and therefore what you want to have is confidence and security, and you want to know that there is a team of people around you who understand what your needs are and are going to be able to help you get better as soon as possible. So I think it is worrying if, in fact, ward rounds aren't happening in the way that they need to. What we've seen, of course, in the last 20 years is that the type of people who are in hospital has changed. So we're seeing more people with complex medical conditions like dementia. And what that means is that there needs to be increasing coordination between different people within hospital wards, not less. So I think it's really important that we see this change happen.
It sounds extraordinary that it sort of isn't happening in many ways, because as you say, you know, you have if there's a discussion going on, you also, as a patient, you don't want to have to be repeating that discussion and trying to explain to other parts of the department what's going on, do you?
Exactly, and I think that's the key, that patient communication for patients, between patients and the care staff and between the individual care staff is absolutely essential. And in order that there's whole person, patient-centred care, I mean, that's what patients need. And patients can be very anxious, as Andrew said, when they're in hospital. And I think that we together, professionally, we're taking a look at ourselves here, and we're saying, this is what we need to do, this is what patients need from us. We need the support of the NHS management and the way hospitals are run to enable us to do this, because in the long run it's going to stop suffering, confusion, poor care, and save time ultimately.
And Andrew, I mean, often people who are in hospital, relatives particularly, they separate out the wish of the care, those who are caring for them, who are trying to help, from, if you like, the problems they're facing, the logistics you're talking about, the time pressures. I mean, anecdotally, are you hearing stories about what is going on the wards that's worrying you?
Yes, I mean, it's a very varied experience. So some hospitals involve families very much as partners in care, if you like, in making sure that they're involved in the discussions about what's going on and the decision making and so forth. But in many cases they're not. And I think sometimes, I suppose if you're working in a busy ward where there's so much to do, it can be difficult to find the time sometimes to talk to the family and help them understand. But in fact, families can help relieve the burden of care very often by helping the person to eat and drink and make sure they're feeling well, and also they can help make sure that the person is in a good place when they leave as
Can
well.
I just ask Linda finally, I mean, would it be helpful if they had to? I mean, if every morning that had to happen, it wasn't a choice. If you're too busy, can't do it. It becomes, if you like, an issue that you could be disciplined for if it didn't take place. Would that be the incentive, or would that get in the way?
I think that we can have a professional incentive, which is about good practice. And one of the things we've done in our report is to highlight there are areas of good practice where this is happening really well, and teams are working together really well, using some tools of checklists and particular ways of thinking about doing the ward round, which is really managing to save time and be safer for patients. Okay. So I think we can build on the good practice and take it forward. And as clinical leaders from nursing and medicine, we've said together that we think that this should happen.
All right, we'll leave it there for now. Thank you both very much for your time this morning.
Thank you. You are watching Breakfast exactly, well, it's just coming up to 7:45. You're watching Breakfast from BBC News. The main stories here this morning. Holiday homes